My name is Dr. Peter Chadha. I'm the co-founder of Bespoke Biotics. Bespoke Biotics is a nutritional supplements manufacturing company. We make all of our products in the UK. And today I'm going to be talking about migraines and neurological problems. We've focused quite a lot of our range on things to do with brain health. So this is one big area that we can tackle. By migraines, I think most people know there are various types of migraine headaches, but we're also talking about supplements that can help with neurological problems generally. By that, I'm talking about things like tremors, epilepsy, Parkinson's disease. So I have personal and anecdotal evidence with some of these supplements working, for example, in epilepsy. With all these things, you have to do your own research and take advice from your doctors, but you will hopefully get some tips in this presentation which will help you find some supplements to help you with your problems. So moving on, what do we know about migraines? Migraines are a major cause of recurrent headaches. They affect about 16% of primary headaches, and migraine afflicts about 20% of people. Migraines are many types, and they have many side effects like nausea, vomiting, sensitivity to light and sound. The exact causes of migraines are not known. And on the right, you can see we've listed some of the types of migraine headache that can occur. So moving to look at supplements that can help, our first product here is called Migrasoothe-B. Now, what is Migrasoothe-B? It is a very, very high dose of vitamin B2, which is also known as Riboflavin. Now, why is vitamin B2 thought to be responsible to help with conditions like migraines? Well, Riboflavin, like all of the vitamin B class of vitamins, is involved in the nervous system. And B2 in particular is activating, as far as energy metabolism goes, with mitochondria in our cells. Mitochondria we've got 1,000 to 2,000 mitochondria in each one of our cells, and they act like little Duracells, converting energy or making energy available for bodily functions. And B2 is critical in that role. So Migrasoothe works. If you take one tablet per day, you will find benefit. And don't just take my word for it. You can find information in the newspapers and what have you, and in the clinical papers. But really, in the UK, we have the National Institute for Clinical Health and Clinical Excellence, NICE, and NICE on their website will list this dosage, only this dosage, not less. Normal vitamin Bs will not do it. Our other supplements which have regular type of vitamin B concentrations will not do it. But this particular product, which has, I think, 120 capsules in it, which will last you a good few months, is the right kind of dose to help with this particular condition. Now, the second supplement we're going to look at today is Magshield 300. This is our supplement, and we sell it in either 60 or 120. Magshield 300 is a high-dose CoEnzyme Q10. So why does CoEnzyme Q10 affect headaches? Because normally people associate CoEnzyme Q10 to help with heart energy and heart function. Well, scientists have found people who experience migraine attacks have lower levels of coenzyme Q10. Now, coenzyme Q10 is a cofactor that converts nutrients such as fatty acids and carbohydrates into energy. So basically, we've got the same theme here: vitamin B2, coenzyme Q10. They're all about energy manifestation in the cell, and it helps with migraine headaches. The dose here is 300 milligrams, one capsule per day, generally taken in the morning is fine. So our third supplement I'd like to look at today is Magshield Pro. Magshield Pro is actually magnesium citrate. And why magnesium? Well, they found that magnesium helps with over 300 functions in the body. And it's one of those supplements that in this day and age, our food seems to be critically low in magnesium nutrients and making those nutrients available to us. So you'll find that there are different types of magnesium you can take. The typical one, which is magnesium carbonate, is not really so good. Our magnesium citrate is more of an absorbable, and it comes in an absorbable cap, and it is helpful for neurological conditions. Magnesium is involved in regulation of neurotransmitters, and deficiency again is reported in migraine patients. And it's thought that periods in women cause extra depletion, so that sometimes is associated again with bouts of migraines, or in females, and bouts of epilepsy, for example. So again, it's a critical nutrient that we should all be having anyway. I personally take it. So magnesium is a great nutrient to have for all bodily functions, particularly as the older we get. Our nutrition is compromised generally just by getting the process of getting older and our assimilation. So the dose here is at least 2 capsules, 500 milligrams, one morning, one afternoon, evening. And you can, if you want to, increase that to maybe 3 capsules a day. So now our next supplement we're going to look at is Infosus-B. Infosus-B is actually an enzyme called bromelain. Bromelain is an enzyme that's found naturally in pineapple stems. It's found somewhat in the leaves, I think, as well, and it's found in papaya. It's an enzyme that is a protease. It breaks down protein. And in South American and native medicine, it's been used for many centuries to relieve pain, support digestion, and reduce inflammation. And as an anti-inflammatory, it's an anti-analgesic. It reduces pain, and again, it can help with the migraine and again neurological problems. It also helps with all sorts of other things, as do most of these supplements. The dose here is 2 capsules a day. You can have a day or evening. I don't think it really matters. Typically, if you're looking to improve your digestion, you would have this supplement with food. But in our case, because we're looking at it at the migraine point of view, we can have it without food. We'll get better efficacy. Looking at the next supplement we have here is Optinak Pro. Why Optinak Pro? Optinak Pro is N-acetylcysteine. It is a precursor of the amino acid glutathione, which is energy producing. Again, same theme again, energy all the time. It's a detoxification of liver, lungs, and it aids in mood for many people. Helps with things like asthma too. And it is combined with vitamin B6, and B6 is again a very important cofactor, and it releases serotonin and other neurotransmitter, and it works synergistically with NAC. The dose here is 700 milligrams, 2 of our capsules per day, 1 morning, 1 evening, again to help with the conditions that we are dealing with today. The final product I'd like to talk about today to help us with migraines and neurological issues is NeuroPower TRP. This is our product of tryptophan, 220 milligrams of tryptophan. Tryptophan is an essential amino acid. Basically, you can think of it as a subcomponent of protein. Because amino acids, when you join them up together, they make long chain proteins, which is what we, as animals and anything with life,